And last, providing testimony in opposition to the legislation is Dr. Malcolm Edwards.
Thank you very much. I appreciate each one of you willing to listen to us. Our core leadership, optometry and ophthalmology, over the past few years have had a lot of opportunities to be together. A lot of people would think we almost don't like each other, but that's just not true. We do work together. We need each other. There's no way either side can provide the eye care that our citizens need. So that's a given. And yes, they are doctors. They're doctors of optometry and should be respected, and we do respect them. But my concern is, why is this bill needed? Let me address one thing immediately. It's not asking for skin tags. Under Section 2, number 7, it says excision and drainage of lesions of the lid and ocular adnexa. Lesions include skin cancers. They're not qualified to diagnose and remove skin cancers, and I think most of their members would agree with that. It doesn't say skin tags. So while we're going to be exact, let's just be very careful about what we say. The other thing is, I practice in a rural community too. Deborah Long and I are from the same community. Lancaster is really known as south of Charlotte. We almost don't have a name. But we take care of a lot of patients, and I'm in a very busy practice. I perform approximately 10 to 15 of these procedures per year that they're asking to do with the incision or the injection subconjunctivally into the eyelid. And I see approximately 40 patients per day. That's not a lot of need. And I've never in 23 years seen a patient go blind or lose eyesight because they did not get immediate attention to one of the procedures being requested. As far as us taking care of patients that are indigent, I think everybody in this room that has a title doctor.
I am so sorry that the time is really running.
Certainly.
Oh, you're okay.
I'm sorry.
That's okay. I'll end my comments there. I'll just take questions.
Are there questions from the committee members?
Yeah, I have a question.
Okay, Dr. Thurman.
You say you're an ophthalmologist?
That's correct.
Okay. I'll pose the same question I posed to the previous doctor that was is there a distinction or difference between your qualifications between you and an optometrist that would disqualify them from performing what they're asking to do?
The answer is yes, but there's a lot of things that are being asked in this, so it's a broad term. But
okay, let me ask you very specific.
Yes.
They're asking to perform the, is it lacrimal drainage system, which is the structures concerned with the tear collection.
Correct.
Specifically, what is the distinction between the qualifications that would not qualify them to do that procedure?
My answer is that with a question. How many of these procedures have you performed in your training? And of all optometrists practicing, been through the training and performed these procedures, taking a course does not qualify you because it's repetition of the procedures that you go through as a medical doctor that make you qualified, not just understanding the procedure. So my question is, how many of these? And we do numerous of these through our years of training. I mean, it's really on a daily basis. 2,000 hours or more per year for 6 years, becoming clinical training. Now, 3 of that's ophthalmology alone, but you do these procedures numerous times, and that's the qualification, is the number of times you perform these procedures with someone with clinical training observing you as a tutor, making sure you do it correctly.
So if I'm understanding, you're saying they have received the training, they just have not performed the procedure.
I can't answer the question if they've received the training because I don't know, but I can say that the majority of the optometrists, when I speak to them just on a one-to-one level, how many injections have you performed in the eyelid? How many injections have you performed subconjunctivally? The answer ranges from 0 till I've done 1 or 2 in a course, or my professor let me do one on him in another country. I've never been able to get a clear answer, how many have you done before you do this on a patient?
And I would just add a question. Would that be because you're speaking with optometrists in South Carolina where by legislation they are not currently permitted to perform those procedures, doctor?
That's a good question. In my practice, over the 23 years, we've had 4 optometrists work in our practice with us. One was from Alabama, trained in Alabama, and I don't know what every state allows, but I do know that 48 out of 50 states do not allow these procedures being requested. And that's, the majority of states do not allow that.
Representative Hart, did you have further questions?
Well, the only thing I want to mention is I want to receive the comfort level that they've received the training. I still haven't received an answer to that yet. And I'm not, I thought I understood when you said that it's possible that they received the training and just hadn't been able to perform the procedures. And if that's the case, I'm comfortable with that because you gotta start somewhere. You gotta get to 100, you gotta start at number 1. So they would have to perform their very first. I want someone to give me an answer, have they received the training? I hadn't received that.
Yes.
And Representative Hart, we have some amendments that a committee member will be introducing that help tighten up the language about required certification. So I thank you for your testimony.